Trinidad and Tobago, like the rest of the world, is currently experiencing what we would classify as a co-circulation of COVID-19, influenza, and other respiratory pathogens. As a result, we have an increased number of individuals with respiratory infections. This isn't strange though, because October to May every year is classified as a flu season, where we see individuals with flu-like symptoms, which includes runny nose, cough, fever, muscular and body pains, and so forth. As far as I am aware, we've only recorded about 4 cases of COVID-19 in Tobago specifically between December and January. We have had no COVID-related deaths as far as I am aware in Tobago for that period. Of course, these are just reported cases, and there may be individuals who have COVID-19 who simply have not reported to a health facility for us to pick up those cases. We have also had no hospitalization of COVID-related cases in Tobago, and therefore we do not have any cases that have made it into the ICU. It's important to note, though, that we are seeing some serious cases of influenza and other respiratory infections, and those are causing hospitalizations. We're seeing them in both adults and children. Again, these are non-COVID related respiratory infections. The numbers that I have thus far are about 2 influenza specific cases for the flu season, and a host of other respiratory pathogens. These include RSV, rhinovirus, human metapneumovirus, and others. So we are seeing those cases, and those cases, some of them are very serious and are making their way into our health facilities. Because of this, it is important for us to recognize the importance of doing the things that can help us prevent getting infected with any of these respiratory pathogens. What are those? These really are the things that we were telling you about during the COVID period. That includes washing your hands with soap and water very frequently. It includes covering your cough, so coughing into the crooks of your elbow if you have to cough. It also includes social distancing, staying away from crowds if possible. Wear a mask in public, particularly if you are in one of those high-risk groups, meaning you have a comorbidity or you are in a space where there are a lot of people generally and you cannot social distance. Particularly if you have flu-like symptoms, we are encouraging you to wear your mask. So for example, if you have flu-like symptoms and you are probably experiencing allergies because we have quite a bit of Saharan dust happening, it means you probably have runny nose or you're sneezing and you still have to go to work, for example, because you are not really ill. We are encouraging you to wear your mask when you are in public. If, for example, though, you are ill, you do have these flu-like symptoms and you are definitely ill, we are encouraging you to isolate. So please stay at home if you can. Keep your children at home if they are the ones that are sick with these flu-like symptoms. Of course, we are encouraging individuals, because we do have the flu vaccines in Tobago at our primary healthcare facilities, as in our health centers island-wide. There are specific schedules where each facility provides the flu vaccines at those times, and we are encouraging people to get the flu vaccine. Again, what we are experiencing in Tobago is really what we're seeing worldwide, which is really a co-infection, a co-circulation of COVID, of influenza, and other respiratory pathogens which cause respiratory illnesses. And what we are encouraging you to do is all of the hygienic practices that